Our brains are precious, intricate organs, the command centers of our bodies. Cerebrospinal fluid, or CSF, is crucial. CSF is a clear liquid that cushions the brain and spinal cord. It maintains the brain's environment for optimal function. Analyzing CSF helps diagnose neurological conditions. Cerebrospinal fluid is often compared to a cushion, protecting the brain from physical trauma. But CSF's functions extend beyond shock absorption. It provides buoyancy, reducing the brain's effective weight. CSF also removes metabolic waste and maintains chemical homeostasis. This multifaceted role is crucial for brain health. Accessing cerebrospinal fluid is crucial for diagnosing neurological conditions. The most common procedure is called a lumbar puncture or spinal tap. The patient lies on their side with knees drawn up. The doctor numbs the area between two lumbar vertebrae. A thin needle is inserted to collect CSF. The CSF is sent to a lab for analysis. Technicians examine its properties for abnormalities. Examining cerebrospinal fluid provides invaluable insights into the health of the central nervous system. It acts as a diagnostic window, allowing physicians to detect a wide range of neurological disorders. One primary reason for examining CSF is to diagnose or rule out infections like meningitis and encephalitis. CSF examination is also crucial in diagnosing subarachnoid hemorrhage, often caused by a ruptured aneurysm. Multiple sclerosis can also be diagnosed with the help of CSF analysis. Specific proteins and cells in the CSF can indicate an MS diagnosis, aiding in early intervention. The journey of CSF analysis begins with a simple visual inspection. Normal cerebrospinal fluid is clear and colorless, resembling water. Any cloudiness, discoloration, or visible blood can indicate an underlying problem. For instance, cloudy CSF might suggest an infection, while blood could indicate bleeding. Beyond color and clarity, the pressure of the CSF is also measured during a lumbar puncture. Elevated CSF pressure can be a sign of increased pressure within the skull, guiding further testing. The chemical composition of cerebrospinal fluid reveals vital clues about the health of the central nervous system. Laboratory analysis of CSF measures levels of substances like glucose, protein, and lactate. Low glucose levels can indicate bacterial meningitis, as bacteria consume glucose. Elevated protein levels can be a sign of inflammation, infection, or damage to the blood-brain barrier. Elevated CSF lactate levels can indicate a lack of adequate blood flow or oxygen supply to the brain. Analyzing these chemical messengers provides valuable insights into neurological symptoms. Beyond its chemical composition, cerebrospinal fluid harbors microscopic clues for diagnosing neurological disorders. A microscopic examination of CSF involves counting and identifying different types of cells. Normally, CSF contains very few cells, mainly white blood cells. An elevated white blood cell count suggests an infection such as bacterial meningitis. Elevated lymphocytes may indicate viral infections or autoimmune conditions. Microscopic examination, combined with chemical analysis, provides a comprehensive picture of the cellular environment. In addition to standard examinations, specialized tests can provide deeper insights into specific neurological conditions. These advanced tests target specific proteins, antibodies, or genetic material in the CSF. Immunological tests detect antibodies, useful in diagnosing conditions like multiple sclerosis. Polymerase chain reaction, PCR, amplifies and detects specific DNA or RNA sequences in CSF. PCR is highly sensitive and can identify genetic material of pathogens, aiding in diagnosing infections. These advanced testing methods enhance diagnostic accuracy and allow for more targeted treatment strategies. Cerebrospinal fluid holds a wealth of information about the health of the central nervous system. Analyzing CSF through lumbar puncture and laboratory examinations provides invaluable insights. From diagnosing infections to identifying bleeding within the brain, CSF analysis is crucial. It aids in early detection, accurate diagnosis, and effective management of neurological disorders. Understanding the importance of CSF analysis empowers individuals to advocate for their health. By unlocking the secrets within this vital fluid, we pave the way for better neurological care and improved outcomes.